Okay, if I'm going to talk to you about the vestibular system, which is a really cool system that does a lot of really cool things, I don't want to give you a wall of textbooks or a mountain of work to do before you're going to get anything to do. We don't just want to give you papers and papers and books and books, mostly because that is just not going to orient you. So what I want to do is orient you to where we're going to go. And that means that you're going to be able to place all of that granular science in context. And for years, I was just exhausted and sad. Tears. Because it was a lot of work and it was worth it. But what I want to do is shortcut you so you can just do the things that you need to do to understand the system straight away. Okay, if I can save a bunch of people a few years of frustration, I'm really happy. So let's talk briefly about the things that we're going to cover. But first of all, I'll put that inside a bit of a why. All the vestibular system actually is inside a bony head. It's 3 canals and a little chamber that has 2 types of receptors. And all it really cares about is telling you, 1, which way's up, and 2, am I moving? And that's it. And if you break the second one down into 2, it's am I moving rotationally, which is essentially spin, or am I moving in a straight line? And that's pretty much it. So it's got 2 receptors that are actually specialized for that, but that's the only information that goes into the brain. So the 2 different receptors are essentially, we'll talk about them later, but you can see straight away that there's things that you can look at straight away in your everyday practice, which is what we're clinicians, that's what we're here for. And that's the straightness of the spine, which is essentially controlled by muscles that are controlled by outputs of the vestibular system, among other things. But we can also look at posture, because often this isn't quite right. Or your head tilt, if your eyes are there, are not exactly where they should be. Your nose might be a little bit out of whack, or your ears might twist the other way, or you might tilt. Often, but not always, that's because your vestibular system is telling the muscles that control these things in your eyes, your neck, your spine, and your body, of course, what to sit, where to sit, what to do. And this gives you all your angulations, tone, and position. And that's what we're looking at every single day as clinicians. So that's why it's important. Well, that's the first reason it's important. Okay, so let's talk about receptors. So basically we have a canal. But if you look at just one subsection of it, it's pretty much a specialized set of hair cells in jelly. And when it moves one direction or the other, what you have is these hair cells will move and deflect. So they look like this. Now, if you have fluid that goes this direction, you're going to get them looking more like this. And that's going to increase the signal. So sort of your normal signal is this, increased signal will be this. You go another one down, go back the other way, and you simply decrease the signal. And that signal goes into the brain and pretty much gives you an idea of, are you rotating? And how fast or how much. The second type of signal is, am I moving in a straight line? And this one's also tilt, because the very nature of this receptor means that if you move it one direction, or if you move it one direction or the other, what you'll find is it'll do the same thing as if it's tilting. And that's where you have something that's called the tilt translation problem. All that means for later is that the brain fixes that, or the brain and brainstem needs more information. And that's part of the reason that you need eyes and body as well. So let's have a look at those receptors. So like the other ones, here are the other ones like this, they were just hair cells. These ones are also hair cells, but they're all about the same size. They have a little mattress on them. So when you move, if you tilt this mattress, so you tilt that surface, what you'll find is those hair cells will deflect. So what we're looking at here is that little angle there. So that little angle changes, okay? The same thing when you move. If we move this that way, what you would get is this little deflection here. Same thing, that's the angle changing. So that's going to change the signal that goes into the brain. So that essentially gives you straight line. But it also gives you tilt. And tilt is essentially another way of working out more about where is up. So the apparatus these things live in, if that's your head, that's your nose. They basically live in what's called an orthogonal plane. So you have round, round, and round. That's basically like the edges of a cube. Now, you can move your head in any direction and you'll get movement through these fluid-filled tubes. And those are basically connected down to your, or into your brainstem, and then via your brainstem with other information from your eyes, your brain, and your body into the vestibular nuclei. So when you read about the neurophysiology, the reading you need to do is to read more about the apparatus, which also has a little vestibule in here, which has the otoliths. You need to read about both of those. You need to read about the nerves. You need to read about the way they work, which is the neurophysiology. You need to read about the anatomy of the brainstem. A little bit later on, you need to read about how all those things go wrong. So that's your pathologies. That might be a vascular pathology, infection. It's damage to all of the parts along here, whether it's the nerve, the actual canal, whether it's grit in the canal that gets caught on the receptor, which is your BPPV or your other things where they can get stuck. You can have little windows in here that blow out. You can have dehiscence where this thing doesn't work. So you need to read about those. That's your pathologies. I'm not going to cover a lot of those in the workshop because I'm going to assume that you've read about them already. The reason that is, it's not because they're not important. It's because they are very important. But what we find is that most people who we see with vestibular problems are really presenting to us with things like neck problems. If we go back here, they're presenting with neck muscles that just won't go away, or stubborn head tilts, or we'll go later into more of what the vestibular system controls. But it's not just dizziness. It's not just these hard pathologies that you can find, because you can see a lot of these if you look carefully enough. You can see a vascular insult in the brainstem on an MRI. You can see on a CT or an MRI some of the problems in here. These are pathologies you can see, and they make sense, and you can test them, and they're a lot easier to see. What we see a lot of is that these things are intact, but the circuitry is not working well. So either there's a problem in the brain, a problem in the eye movement integration, a problem in the cerebellum which controls this, and that's more what we're looking at. That's what a lot of problems are that come into the offices that have been through these workups. So we like to target in our workshops ways to address things that you won't find in the literature so readily, the practical things you can do. Okay, so we've got the information in, and we know it comes from the apparatus. We know it comes from the eyes and vision. And we know it comes from the body. But then what's the out? Now the output is also to eye movements and to muscles in the spine and body and the neck. So we can measure those things, and we already do it every single day as chiropractors, as physiotherapists. A lot of times as OTs, we're measuring those things, we're looking at spinal curves. So it's nothing you're not looking at already. It's just things that we're going to be able to tease out a whole lot more specifically, so you can work with them much more efficiently and with more confidence and enjoying it a lot more. Because let's face it, knowing more about the system means that you have a much better time. Okay, so we know what comes out of the brainstem. So if we're just gonna look at eye movements, what can we actually test? So all of these here are more or less your head moving eye movements. So they have to have some vestibular contribution, almost have to. You can have the vestibular system not working and still have them working, but essentially they're your more vestibular eye movements. So you can look at, is there nystagmus, which just means do the eyes wobble when they're just sitting there? And you can do that with fixation or without fixation. So you can just observe the eyes and see if they're moving, or you can see if there is a, you can take the fixation away by using an ophthalmoscope. Secondly, you can check the VOR, and that's just turn the head to one side and see if the eyes stay where they are. And the A is for angular and T is for translational. So we're just covering those two different planes off. And the planes, incidentally, look like this. They're what's called your Cartesian planes. So we'll go into that a little bit further in another talk. And the Cartesian planes are essentially up and down, side to side, and back and forth. They have fancy names, but that's what they are. And then rotation is just movement around those axes. So you can be in this plane here, which would be your pitch, around this one here, which would be roll, and around this one here, which would be your yaw. That's it. It's as simple as that. Okay, so you're going to check, that's your angular VOR. Your translational VOR is anything that moves along there. Okay. HIT, that's your head impulse test. That's just taking your head and moving it quickly in one direction. It's as simple as it is. Head shake, same thing, but a little bit slower, a little bit longer with your eyes closed. I do this one, eyes open and eyes closed, in a bunch of different varieties, just to tease out a few more things to measure and look at. I just found that's really practical. Dynamic visual acuity, just fancy words for putting up an eye chart and just having the patient read it while they turn their head side to side. Now, if you've got a good VOR and therefore good integration here and probably good integration or good integrity here, you can still read a line on a chart while your head moves. That's the whole point of vestibular system. That's its primary initial function. Now, the rest of the ones we're looking at are more so your cancellation. So can you not do it? And that's basically your frontal lobes coming down and saying, we like that you can do this, but we want to keep our eyes where we want them. Second thing is your smooth pursuit, just a fancy way of saying, can you track with your eyes? Now you might say, wow, is that actually vestibular? And not technically, but it does use a lot of the same circuitry. So what you'll find is if that's not working well, it's pretty hard for you to smooth pursue. There's a whole lot of extra brain circuitry on top of that, but you can check it. Now with your smooth pursuit, then you can, at the end of it, if you're doing it a crosshatch pattern, so you're going to have your eyes and you're going to go all the way this way, 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 up. I do up and down because I like to see when the eyes, how they jump. I get a lot of information from that. It's not in your standard tests. So all these are essentially eye muscles that you can test, and we'll go into them. So eye muscles are on your eyeballs and they cause these movements. Upward movement is essentially a combination of all these. So it's upward movement is basically relies on a lot more integrity. So we test the lower ones first. So we're testing those. You can bang off and do another extra test at the end by just seeing if the patient can hold. So if they start to bounce, they should just be able to hold nice and tight. If they start to bounce and wobble, that means you've got a little bit of an end gaze nystagmus there. Pressure tests are essentially, be careful with these. If you're not sure, don't even try. But they're basically putting pressure inside by pulling the tragus, which is the ear, just subtly changing the pressure inside the area of the apparatus. So they're more tests of peripheral hard pathologies. Fast eye movements, which are another higher level up, and they require a lot more brain in this part here, and a little bit of this part here. And I think that's it. So that's your eye movements, and they're all relevant to the vestibular system. So next we'll talk about, and we'll go into that in our workshop, but you can go and look them up. And if you really want to, David Trust has done a spectacular eye movement video of the neurophysiology of these eye movements. It's really good, but it's pretty advanced. So go and watch it. And if you're a beginner, let it wash over you like a bad dream or a beautiful or a good or a bad dream. It's a good dream because it's so elegant, but it might overwhelm you a little bit. So don't be overwhelmed. Just enjoy it. Other things, you can look all of these things up in a textbook. There's nothing new here. What we do with it, how we apply it, how we routinely measure things, how we intervene in these cases is what we'll talk about, and the practical ways we can do that. Okay, that's probably enough for one day or one session. So what do we do next? Where do we go now? Okay, we're going to make some more videos. And we'll cover a lot of different things, but a lot of these things we'll cover in our workshops. Now, in our workshops, we won't cover a whole lot of things that you can buy in a really good textbook, because there are lots of them and you can just cover them yourselves. We won't charge you to basically tell you what's in a textbook. No, it's better that you cover that based on this overview that we've done, and so we can go straight into the really interesting stuff. Another thing that's really important to mention is that the vestibular system it's not just eyes and it's not just posture. It's also a couple of other really important things, which is your autonomics. That's your heart, breathing, it's your limbic system. It's emotion. It's also other things like your sense of self, well-being, even your emotional regulation, and even your cognition, so your executive function. So what we find when we do work mostly with these things is that often we can improve these things, and sometimes we'll actually measure them. So it's really not just about eyes and posture, or even dizziness. A lot of most patients don't come to your office because they're dizzy. They come because their neck hurts or because they just don't feel well. The great thing is when we work on these systems at this level, we can improve often these things, and these things. So it's more like a pleasant side effect of therapy. So in our workshops, we have the wonderful David Truster. He's great. We are very, very blessed to have him. He's done, the reason you should come, he's done over 1,000 hours face-to-face training. And that's all, complex neurology. So he knows the details, He's also done over 1,000 hours with the man himself, Ted Carrick, without whom none of us would be here. Ted Carrick is a genius. And if you can't have him, you might as well have someone who's trained with him very closely. So he's been directly supervised for over 1,000 hours. What does that bring to us? It just brings, crystallized observation. It brings expertise, and it brings application. And without any exception, the most of our feedback is people have done all the study. They've got all the content. They've read all the textbooks, but they can't apply it. And that's what we want to help you to do, apply it. So we look forward to seeing you. It's February. It's the beginner is the Friday to halfway through Saturday. And your more advanced is Saturday and Sunday. We'll kind of split them in the middle. Now, come to both, because at this seminar, the advanced seminar, just let it wash over you if you're a beginner. Just see what's possible. Be inspired. We have bought this guy 16,000 kilometers, something like that, to your door, so you can get out of bed after eating breakfast, turn up and just watch a master in action. You'll love it. He's really good. He's done some really great cases. He's presented for AFN conference. Beautiful, very well regarded talks the last couple of years. Extremely high regarded teacher. Don't stay at home. Don't not come. And if you're a beginner, still come, because you'll see what's possible. This is the cutting edge, what's happening cutting edge across the world. So we really look forward to seeing you there.